3 more seemingly random symptoms that can be caused by POTS. Hi, my name's Elena, and I have postural orthostatic tachycardia syndrome, or POTS, which is easier to say. I was diagnosed 4 years ago, but I'm not a doctor, so none of this is medical advice. This is just my personal experience. Now, POTS is a circulatory system issue. When a POTS patient stands up, blood pools in our legs, and our brain ends up starved for oxygen. In order to compensate for this, our bodies will pump our systems full of adrenaline to try and get our heart rate up to get blood into our brain. Because of this, our bodies are constantly in a state of fight or flight, so these 3 symptoms are all related to adrenaline dumps. Number 1 is called an adrenaline attack. This looks a lot like a panic attack, but it's not quite. You basically took the opposite way to get there. Because your heart is going so fast and your system is full of adrenaline, eventually your body ends up convinced that you aren't safe. So adrenaline attacks look a lot like panic attacks or anxiety attacks, but it's not caused by racing thoughts. It's caused by the physical response that your body is then reacting to. When I experience these, I end up shaking and crying and hyperventilating, and I can't feel my arms or my legs. Number 2 is actual panic attacks. It's very common for POTS patients to be misdiagnosed with an anxiety disorder just because our nervous systems are always in fight or flight because of this extra adrenaline. Unfortunately, it's also very common for POTS patients to later develop an anxiety disorder because we've been stuck in fight or flight for so long. Having your nervous system dysregulated this severely for this long can lead to long-term anxiety. And number 3 is night terrors. These are caused by adrenaline dumps when you're trying to go to sleep at night. I haven't experienced these as severely as some POTS patients, but I have experienced the insomnia that comes with them. There are so many symptoms that can be caused by POTS that may seem unrelated. You're not going crazy. These are all real, valid experiences, and you're going to be okay. Okay, I love you, bye.